Hello, my name is Sheza Malik and I'm currently affiliated with Rochester General Hospital in New York, USA. Today I'm excited to discuss our paper titled Efficacy and Safety of GPOIM or gastric peroral endoscopic myotomy across different etiologies of gastroparesis. Our systematic review and meta-analysis was conducted alongside collaborators from several other institutions across USA. So the first question that comes in our mind is why this study? Gastroparesis, as many of you know, lead to debilitating symptoms like nausea, bloating, and vomiting. While GPOIM has been used for treating refractory gastroparesis, we noticed that there wasn't much clarity on how well this procedure works depending upon different causes of condition, such as diabetes, post-surgical, and idiopathic origins. This led us to ask, can GPOIM be equally effective regardless of underlying causes of gastroparesis? Our study is one of the first to explore this specific angle, providing insight not just into overall efficacy of GPOIM, but also breaking it down by the distinct cause of the condition. Our systematic review and meta-analysis included 15 different studies covering 982 patients across various regions of the world. We analyzed both prospective and retrospective studies to make our results as comprehensive as possible. While we were particularly interested in two outcomes, number one was clinical success rate of GPOIM broken down by etiology, diabetes, idiopathic, and post-surgical gastroparesis. The second outcome that we measured was improvement in symptoms, which we measured using Gastroparesis Cardinal Symptom Index called GCSI. Using established statistical methods, we derived pool estimates and performed subgroup analysis to see how different patient population responded to GPOIM. Now let's discuss what we found. Overall, GPOIM demonstrated significant clinical success with a pool success rate of 72.6% across all patients. However, when we looked at specific groups, for diabetic gastroparesis, the success rate was 65% and the symptom improvement on GCSI scale was about 1.7 points. For post-surgical patients who had the best outcome, the success rate was 70% with GCSI improvement of 1.34 points. Lastly, patients with idiopathic gastroparesis had a 60% success rate and symptom improvement of 1.5 points. These results highlighted that while GPOIM is broadly effective, post-surgical patients may benefit the most from this procedure in terms of clinical success. However, diabetic patients showed most substantial improvement in symptoms as measured by GCSI score. One important aspect of our study was also to assess the safety of GPOIM. We found that it is a safe and minimally invasive procedure with no significant adverse events reported across studies we analyzed. What makes our study particularly important is that it fills a knowledge gap regarding how GPOIM works across different etiologies. Many previous studies focused on overall efficacy of the procedure, but we broke it down to answer more specific clinical questions about its utility based upon the cause of gastroparesis. So what does this add to existing knowledge? Our findings suggest that patient selection may be the key to optimize outcomes for GPOIM. Post-surgical patients are likely to achieve high success rate, while diabetic patients, though having slightly lower success rate, experience meaningful symptom improvement. This insight helps personalize treatment decisions, guiding clinicians on what patients might benefit the most from GPOIM. Now, what about the next steps? Moving forward, we believe that more prospective studies with larger sample size and the longer follow-up periods are necessary to validate these findings and further refine the treatment protocols. Additionally, it would be beneficial to explore biomarkers or diagnostic tools that could better predict what patients will respond well to GPOIM. So to sum it up, our study confirms that GPOIM is an effective and safe treatment for refractory gastroparesis, regardless of the etiology of gastroparesis. The procedure offers hopes to to the patients who have exhausted other treatment options, particularly post-surgical patients and diabetic gastroparesis patients. However, like any other medical intervention, further research is needed to optimize its application and improve patient outcomes even further. Thank you for your attention, and I look forward to any questions or further discussion on this important topic.